Hi, I'm Dr. Kiran K J. I'm a senior consultant in Department of Minimal Access, GI and Bariatric Surgery, Apollo Hospital's Bannerghatta Road. Today I'll be discussing about gallbladder disease or cholecystectomy surgery. So, a lot of people go for a health checkup. They get an ultrasound as a part of the package and they'll find to get a gallbladder stones. So, ideally that warrants a surgical attention. So, we see the patient, we try to counsel them that this is a vestigial organ, it is better to get operated. Because other scenario where we see a gallbladder stone disease is patient, I'll be back home, I'll get a call from the emergency telling that this is a patient with severe vomiting and upper abdominal pain, and it also goes to the back. So then we get an ultrasound, then we get to know that calculus cholecystitis, that is the stone is impacted in the gallbladder neck and is caused severe pain, or it may have fallen down to the pancreas causing pancreatitis. So this is an emergency situation. So what next? The only answer is we should evaluate the patient and take up for surgery if there is no stones in the gallbladder common bile duct or a pancreatic duct. So if there is a stone in the bile duct or a pancreatic duct, we have to do an endoscopy called as ERCP, remove the stone, and the day next we have to do the surgery. So ultimately the answer is only surgery. So gallbladder, once it has stones in it, it is a direct and very serious indication to be operated. There is no medical treatment. A lot of people go to general practitioners. A lot of general practitioners doesn't see the emergency situation of a gallbladder disease. So they usually try to give deoxycholic acid, that is UD-Leave and all those tablets for long time, just wasting the money of the patient. I'm very sorry to tell that, but yeah, gallbladder stones is purely a surgical entity, it has to be operated. And a lot of patients ask, sir, you're removing an organ, why not only stone? So basically, a lot of people's kidney stones where only the stone is removed. Definitely there is a valid question from the patient, but kidney is a very essential organ because kidney, liver, heart, these are very essential organs for a human being. There we have a method to remove only the stone. But in gallbladder disease, there is no way we can remove the stone. There is not even a single scope that has been formulated. There is no laser that can shoot the gallbladder stone, because gallbladder is a very thin structure. It is a pocket of bile which is stored there. See, basically we call it as a vestigial organ. So what is meant by vestigial organ? When we are in our mother's home during pregnancy, when we are in mother's uterus, all the organs will develop. In that phase, liver and pancreas will be developing. In between that is the gallbladder, is the outpoaching of the bile duct. So it doesn't secrete any enzymes or a hormone to contribute something to our body. It's just seated there by virtue of our development in the mother's home, that is embryological development. Like you may also find a patient with appendicitis where appendix is removed. So appendix is also vestigial organ. It is located between the small intestine and large intestine. It is also outpoaching in between those two things. So these two are vestigial organs. So when you get appendicitis, we will remove it. You are aware of it. Like that, gallbladder, once there is a stone, then it's a warning sign. It has to be operated. They will say, I have only one stone. There is nothing like one stone or six stones or big stone or a small stone. It's like, one bullet in a revolver is enough to cause problem. Whether it is a small bullet or a big bullet, doesn't matter. It is a troubleshooter. So because once there is a stone, that means the bile is already thick. Patients will be having a lot of time, there is a reflex, and they will be having a lot of backache, which may be due to the thick bile which is stored in the gallbladder. Maybe small stones which are not recognized in the ultrasound. So these will be causing problems. So pancreas should not be subjected to any damage, because it is very, very vital organ for us, because it secretes a lot of enzymes, hormones, and other things. Insulin is also secreted in pancreas. So it is very essential. So when you find there is a gallbladder stone, the only answer is to remove it. If you do it as an elective procedure, you are admitted on day morning, we see the liver function test report, and when it is normal, we are going to operate you on the same day and then discharge you on the next day. You can be able to have food after 4 hours after the surgery, walk around in the evening, next day you can go back, and after a week you can see me once. That's the end of it. So if this liver function is variable, we will do an MRI. If there is stone in the bile duct, we will remove by endoscopy and do the surgery next day, and the other next day is the discharge. So this is how it is. And In emergency phase, it is literally, we have seen patients coming with gallbladder filled with pocket of pus. Sometimes some people, come with gallbladder problem which they don't tell to the family, and they come after 15-20 days in sepsis. So these are all the emergency situation we have seen. So the best and the most ideal solution for a gallbladder stones is surgery. You come in elective phase or you come in emergency, we are there to help you. Once you get an ultrasound, you find a gallstone, don't neglect it, because that is a troubleshooter. So better to go for it. It is quite a safe procedure, and definitely the complications or the risk factor is very, very minimal, and nothing beyond our control to handle. So we assure you that it is one of the safest and very comfortable procedure to undergo. Don't panic. Once you have a gallbladder stone disease, please come. Either you come in elective, we are going to help you, or in emergency, we are going to help you. I prefer you come in elective stage. Good luck. Thank you.